Thank you, Liz. Today, we have a number of county staff. Welcome to everyone. Lovely to have you join and see you here, as well as some potential community members. So as you see on the screen, we will proceed to approve the January meeting minutes as soon as we have a quorum, and I'll try and monitor that. And then we'll get some updates from public health and primary health, and then we will have a guest speaker, very wonderful guest speaker on our very important topic for today. So we are slowly gaining members. We'll give it one more minute and hopefully we'll have a quorum. And thank you, Joe Phil. Good afternoon to you and Happy New Year to you and everyone else. It's a wonderful Chinese New Year. Okay. All right. Okay, we have a quorum. So let's proceed to our meeting. I'd like to know if there are any amendments, edits, changes to the January meeting minutes. Hearing none, is there a motion to accept the approve the minutes?
So moved. Steve Heath.
Thank you, Steve. Motion to second.
Second.
Thank you, Libby. And we will vote in the chat as usual to say yay or nay to the approval of the minutes. Okay, let me just. Okay, minutes approved. Thank you. Next item, we have an update on PHAP's board members and the vacancies. We currently have 3 vacancies as we had a new appointment. So as soon as all the forms are completed, we will welcome Mr. Mare. And then we'll be looking to fill just 3 positions. So that'll be terrific to have a new member on. If anybody knows of a good person to serve as a board member, please encourage them to reach out and apply. So to continue on, I look forward to this update from, I think we all do, from Dr. Kassirier on the Public Health Division. Dr. Kassirier, if you're there, you're muted.
Sorry, taking a little bit to get off of mute. Hi, everyone. So as far as a COVID update, I'm sure you're all aware that we are on the good side of the Omicron surge, meaning that the numbers are beginning to go down. Our last case rate for this morning was 110 per 100,000, when we're averaging now about 1,500 cases a day. Our areas of concern, one is with the hospitalizations. It is going down, but it is still high. So we actually worked with our EMS partners to put together some media pieces to remind folks to reserve 911 and the emergency room for true emergencies, because we were hearing of people, especially during the peak of the surge, people were showing up to emergency rooms just for testing or if they had mild symptoms. I think that has subsided. So we'll continue to monitor. The other area of concern is with the jail outbreak, and Sandy's on the call, so she will give you the update on that. So I think I'm sure everyone is exhausted with all the that this pandemic has brought in terms of the restrictions, the masking, the testing, restrictions on travel. So our hope is that as this goes down, that I know the governor has announced that they're developing a plan for being able to start looking at COVID as an endemic, but we don't know yet what that's going to look like. So we'll update you as soon as we have any details. So that's it. Don't know if any of you have questions.
Any questions?
I have one question, Dr. Siri, regarding the availability of Paxlovid. I know it's still limited in some pharmacies and stuff. Is that, do we kind of have an idea of estimated availability of doses and stuff, especially as our monoclonal antibodies are proving to be less effective against Omicron? I think increased access to that would offload a lot of our hospitals and improve hopefully.
Sure, it's been a little bit of a slow start in terms of one, the amount we're getting. I can't remember the total right now. I'll have to get back to you on that. I have to look through my emails, but it's been a small amount. And then I think what we're finding is that it's not very easy to for some of the pharmacies to be able to receive prescriptions from different entities. Many of them do have some requirements in terms of trying to verify drugs that the patient might be taking and drug-drug interactions. So that has caused some delays. And then when we were first given instructions about allocations for Paxlovid, we were told to limit it to just the patient pharmacies, so the hospitals got left out. And so we're trying to rectify that, because we're finding that they're the ones that are actually probably needing this the most. So hopefully in the next couple of weeks, we'll be able to straighten that out, but it has been a little bit of a rough start with the rollout.
I look forward to the progress. Thanks so much.
Any other questions? Well, Steve, sorry. Yeah.
Good morning. Just a quick question.
That's Steve. He'll be at April's wedding, maybe.
Hi, this is Steve Orkand. Just a question or two regarding things that have occurred along with COVID that you might, I'm sure you've been looking at addressing and maybe you can report on. And that is the mental health issues and increased suicides and increased drug addiction issues with overdoses. I'm just wondering if there are steps that your department has been taking to look at some of these related issues.
The issues you have named are actually in our behavioral health division. So definitely we work very closely with behavioral health, but they would be in the best position to talk in more detail. We know that anecdotally, we have heard reports of increased anxiety and increased violence in schools once schools were back in session. So there's definitely a huge need for being able to provide additional behavioral health support And so I think it would be a great idea to have the director of our behavioral health division talk to you in more detail about that. I know that we are working with the schools, school superintendents. We did get some funds as part of the CARES, where, and also from the state, where we are working with the schools to try and increase the services that are available to students, especially for counseling. With the drug overdoses, we also have heard anecdotally that there is an increase. I have not seen the numbers yet because it takes a while before those numbers are compiled for the year. But we also know that deaths are just the tip of the iceberg. Again, another area that needs to be looked at. I know that we were focusing on that prior to COVID. So definitely an area that we should look at again. And I would, again, I think that the behavioral health director would be the best person to be able to speak more on that as well.
Thanks.
And we will invite Ryan to come give us an update. Joe Phil, you had your hand up.
Yeah, quick question, Dr. K. And thank you again for your wonderful op-ed a couple of months ago that our team here may have read already. Wanted to see the availability of testing kits, if that's going to be an issue, and if our in-house county pharmacy have received the KN95 masks that were promised by the administration.
The masks are being handled by the federal government. The counties are not a part of that. So I do not know if they have arrived in the pharmacies. They were supposed to work with retail pharmacies. We have been waiting for an allocation that we requested, but as you know, there have been a lot of delays with supplies, and unfortunately, the mask supply as well as the testing kit supplies has been affected by that. I know that we did receive an allocation from the state a while back, and we were able to work with the public libraries to distribute them to the kits that we got, I think about 95,000 that we were able to distribute to the general public. The kits that we have right now are designated for healthcare entities. So right now we do not have any available for the general public, but if we get any more, we'll definitely, I'll let you know.
Thank you. And I see Steve Orkan has let us know that he picked up his free masks, so they are available. I see that Andrew Mendoza, you're on the call, and I was wondering if you wanted to just give a very quick update in answer to Steve Orkan's questions.
You bet. Thank you, everybody. Hi, Andrew Mendoza, Health Program Manager with the Substance Use Prevention and Treatment Unit over in the Behavioral Health Services Division. And yes, to answer your question, Steve, we have seen anecdotally some information coming in that overdoses are up. Mainly, we're seeing fentanyl deaths in regards to counterfeit pills. We're very active in working with schools, working with our prevention partners and our treatment partners to try to get the word out there, but we are seeing an increase in deaths, not only there, but a mixture of opioids, methamphetamines as cause of death. We do get information from the coroner's office on a regular basis. And again, those numbers are increasing on a variety of substances that are causing overdoses. But my unit is very engaged out in the community, working closely with our mental health partners, with Dr. Quist, and getting all the resources out there that we can to try to combat the increase that we're seeing.
Thank you very much. And as I said, we'll ask behavioral health to give us maybe a more in-depth update. Thanks, Andrew. Nice to have you here. All right, so let's move on to Primary Health Division's update, and Dr. Damiano. Thank you very much, Dr. Castillo. I know how busy you are, so it's great to have you.
Good afternoon, everyone. I also wanted to introduce Stephanie Kelly, who is observing our meeting. So Stephanie, I don't know if you can put on your video for a second, just to wave at people. She's the new Health Services Administrator for Adult Correctional Health. And I'm really delighted that we actually have another administrator for me to train. So it's wonderful. So I'm going to go over a couple of points on the document, and it will come out in your minutes. I don't know if you can make it a little bit bigger in terms of the font for people.
Right. Yeah.
Yeah. Just to let you know, I'm going to hit just some of the high points for juvenile correctional health. They did have a small outbreak. As you can see, they have had 95 cases. This is confirmed throughout the entire pandemic. And during this particular period, they had 7 new cases, which is really unusual for them. Usually they'll have 0 to 1 or something like that. But as of the report on Monday, they had 2 confirmed cases still at YDF. So that's for the youth detention facility. They are doing booster doses of vaccination for those that qualify in addition to the regular vaccinations. For adult correctional health, Dr. Kasiri mentioned the jail outbreak. This is our 3rd outbreak since the pandemic began. We did have the 2nd outbreak, which was on the Delta variant, which ended early December. It was relatively short and had a much less impact on the jails. So it was shorter and had far less cases. Working with this Omicron, I've never actually seen anything like this. This had extremely highly infectious with very short incubation periods. We had staff out during Omicron, pretty sweeping. For custody, we had some medical staff, we had mental health staff out during parts of this, so really profound impact on staffing. And then on the inmates, this is just a point in time this morning at like 7 o'clock or yesterday morning. You can see the population at the jails very high. It's over 3,300 inmates for total population. And the positive in custody is 222 at the main jail and 316 at the branch. How this outbreak is different has to do with this Omicron variant and its infectious nature. What we've seen so far is that we have had sources for positive cases from intake quarantine. So those coming into the facility positive, that's one source. And as the community transmission rate is going down, we should start seeing that on our dashboard, I think this week, hopefully. What we're seeing the profound impact on in terms of these positive cases has been the close contact quarantines for those that were exposed. These could be for people coming through intake quarantine, but what we've had a lot of confirmed cases are from inmate workers at both jails. And so that has really risen to, in terms of our contact tracing, we've done a lot of testing of housing units, and rather than just having some numbers turn up positive, we'll have entire housing units turn up positive. We also do immediate rapid testing on anyone with suspect symptoms, and then have to contact trace on those units. And then also quarantine and test, isolate. What we're seeing for the incoming people, we usually get anywhere from 60 to 70 daily bookings and admissions. So our admissions are down during COVID because there are some restrictions on booking, but we're still a high number every day that we have to do the quarantine on. During the Omicron, the state facilities closed all of their facilities due to their infectious nature and their outbreaks. So the state prison system is just starting to accept some transfers this week. And what they tend to do is accept them in small doses. So the anticipation was 25 this week out of 263 inmates. And then we have 118 people also waiting for state hospital transfers. For the sheriff's actions, in addition to, we have pretty extensive COVID protocols on both sides. They had some additional actions that they undertook. I didn't write them all down there, but I have those. They also released inmates like during the last emergency, but these are county sentenced inmates with 90 days pending on their release. There are only 203 of those. They were all released. I think the week of January 10th or so. They also initiated temporary booking restrictions for all law enforcement entities in our region that use the main jail. Those booking restrictions are the same as the one we put in place during the beginning of the pandemic. We were also asked to pull lists of patients that were either 65 years of age or older and those with certain medical conditions regardless of age. However, of those lists, only 7 were released that met criteria and did not have any disqualifying criteria. So the amount we're able to release hasn't been sufficient to reduce our jail capacity to a comfortable number. Want to go to the next page, Liz, please? Okay, so it will take us a while. Once we get into an outbreak, it will take a while for the numbers to start to deflate. So there's a delayed response from the community case, pretty much because in the community, you're really not testing unless you have symptoms or you're required to by your employer, or you may want to travel or have some gatherings. We pretty much test everyone. So we get large numbers of asymptomatic people that are testing positive. Okay, for the vaccination data, I have it printed up here for you. You can see what we're doing. I think vaccinations are quite little this week. We'll see what the dashboard shows when we publish it today, but we're also trying to track and note the number of boosters. I did receive permission from the sheriff's office, so not the table part, but the little bullet points we will also now have on the sheriff's website for the COVID. So we typically publish our dashboard, or we send it to the sheriff's department to publish on Wednesdays or Thursdays, depending when it's done. So you will see some vaccination data on that dashboard. Okay, vacancies, scrolling down more, staff were interested in that. That will be published for the main jail and the branch jail. For clinical staff, we have 29 vacancies and in various states of hiring. The next page, we have 7 administrative vacancies and 16 mental health vacancies. So we're still struggling to fill those positions. And then I don't know if we have time for this, but I know you're also interested in our population that has a serious mental illness. I think I've shared with you before that we do a data exchange with county mental health or county behavioral health to look at the jail population. So I take a snapshot in time. For example, we took January 3rd. We look at all the inmates. So there were 3,300 inmates. And what you can see on there is 27% had a serious mental illness. And that's been fairly consistent. And then if you scroll to the next page, this little chart shows the exact people that we're seeing on our side in terms of people who have had services in the jail and what they're like on the outside. So you can see for outpatient mental health, 7% were currently open to services. By far, the majority has been discharged. About a third have open full service partnerships. That's our highest service intensity on the mental health side. And for substance use disorders, 8% are open. So you can see the preponderance of people are really close to service on the outside. So this is one of the things we've been working with county mental health, county behavioral health. They get this data exchange, and part of my plea has been to increase services in the community, particularly wraparound services. They will start a Behavioral Health Forensic Full Service Partnership Program on February 15th, which will be our first forensic full service partnership program. So I'm pretty excited about that. Okay, if you scroll a little bit more, couple other updates. I try to cram information in here. As I said, Stephanie Kelly's the new Health Services Administrator. I've been doing 2 jobs for seems like forever, so I'm really happy to have her. And then I know you're also interested in mental health and what are we doing about the mental health in the jails and how are we working to improvement. So one of the things that has happened is in response to the service needs of the jails and the consent decree demands, that management team has been restructured. One individual left, a person that worked with the jails before is now the mental health manager, and she has 2 people under her, one for clinical operations and one for administrative operations. We've seen a great difference in the responsiveness and the work that's being done with mental health in the jail. So I'm very, very hopeful that this is a really positive change that we'll see. There's a board item. Oops. Okay, let me see. I'll read it and then you can go. There's a board item on the main jail ADA improvements by General Services. That was continued to February 8th, and that's really just a contract for an architect to look at ADA improvements at the main jail. And then I know that you're interested in the consultant reports. There will be 2 of them, one on how big can the population be in the main jail to meet the consent decree, because it would certainly need to be much smaller. And then what are the recommendations for population reduction? And so those reports, I think, are going to come out in February or March and should be available. And I'm happy to get those to you when they're public.
Thank you very much, Sandy. Will you be all available to stay on the call for the entire meeting if we postpone questions till the end? Or can you jump back on at the end of the meeting?
Yeah, I can stay.
Thank you very much. So I think our agenda has our guest speaker up next. And I want to stick to the timing. So we will delay questions for Dr. Damiano until later in the meeting. Thank you. I see a couple of hands up and I promise to get back to this. So today I'd like to welcome Dr. Alberto Ayala, and we are very fortunate to have him here. Alberto is the Executive Director and Air Pollution Control Officer of the Sacramento Metropolitan Air Quality Management District and former Deputy Executive Officer of the California Air Resources Board. Here in Sacramento in recent years, we've been experiencing increasingly the effects of climate change and worsening air quality, which impact the health of our population, especially those in disadvantaged communities. So we're very fortunate and delighted to have Alberto come today to help us understand these issues around air quality, climate change, and public health, and the Sacramento region's path forward towards a zero carbon future, which is the title of his talk. So again, welcome Alberto, and I'll turn it over to you.
Thank you, Carla, and thank you so much for the invite. Let's see, I see that you pulled up my slides, so I think I'll let you do the logistics of the presentation. But anyways, I appreciate the invitation. This is a great opportunity for us to come and engage with you guys in particular. I'll admit I'm new to the board, so I'm looking forward to building a relationship and learning about your activities and how we work together. It's interesting. We as an air agency in the region, we think of ourselves as a public health agency as well. And thank you for accommodating my presentation. I certainly didn't mean to get into the middle of your important discussion. So the plan is I put together some slides for you guys. I'll try to get through them as quickly as possible. It's essentially a collection of various topics that I think will be of interest to you. And then we'll have some time for Q&A and discussion. So without further ado, if we can go to the next slide. And I don't know if you want to turn on the full presentation mode, Carla, or if this is going to work for you.
Alberto, would you rather run the slides yourself? Liz can share the screen. No?
I'd be happy to do that as well. Yeah, if you like me to do that. So let me.
Okay, Liz, can you allow Alberto to share his screen? Thank you.
Yeah. So I'm going there. And can you see my screen now?
Yes.
And is it in full presentation mode?
No,
or
it is not yet.
And here we go. Let me do this.
There we go.
Okay, now it should be.
Yes. Thank you.
Perfect. Okay, so the first thing that I'll cover for you is, I don't know to what extent you're all familiar with the structure of the Federal Clean Air Act and how a local air agency fits into the larger scheme of air quality management in the US. But the simplest way to think about it, it's a three-legged stool or pillars. Obviously, there is the US EPA at the federal level. There are state agencies. Here in California, we have the Air Resources Board, and there's a number of regional and local agencies throughout the country, probably 150 or so agencies like the Sacramento Air District. And we all share the responsibility, we all share the authority of implementing the provisions of the Federal Clean Air Act, as well as state and local rules. So that's sort of how we fit into this larger scheme of air quality management. I thought I'd start with just some really high level priorities, just kind of set the stage. Clearly, as I indicated initially, we think of ourselves as a public health agency because our principal role is essentially to protect public health from the adverse effects of air and climate pollution. So that's really the key policy driver that is guiding every single one of our actions. How this gets translated is really attainment of the health-based National Ambient Air Quality Standards, which is a responsibility of the federal agency at EPA. But basically, the name of the game for across the state and the country is to make sure that if we are not in attainment of the standards, that we have a plan in place that will get us to attain those standards as quickly as possible. We are in California, we're unique because the state has authority to implement its own rules that are many times much more aggressive and protective than the federal rules. So one of the roles that we play as a local air agency is implementing the state's clean air and specifically the climate agenda. California started in the business of climate action much sooner than the country. So, we play a role and a responsibility in that regard. One of the most fundamental activities that we perform is essentially the control of what we call stationary sources. So these are industrial sources, these are area sources, these are things like gas stations that in order to be able to operate legally, they have to have an emission permit by us. And with that permit, we ensure that not only are we staying on course to meet the ambient air quality standards, but we make sure that there isn't an undue burden on the local community around a specific source. How do we do that? We spend a lot of time and resources on compliance and enforcement of the permit requirements. Another real critical role that we play as a regional agency is in the CEQA process as a commenting agency. And we try to influence land use decisions made by counties and cities in the best interest of the breathers in the region. No surprise to any of you, the name of the game at the moment is electrification and zero emissions and cleaner transportation policies, simply because transportation, as I'm going to cover in a minute, is one of the largest sources of air and climate pollution. But as an agency that is a part of a community. We play a role in education, in communication, in engaging the community. There is research that is regional, specifically regional in nature. And obviously, we try to coexist and collaborate in an ecosystem of a number of local agencies. We have very strong partnerships with agencies like our local MPO, SACOG, Sacramento RT, SMI, for example. And obviously, Sacramento County is within the jurisdiction of the Sac Metro District, in addition to 7 other cities in the region. And then one element of our work also, interestingly, touches on some international engagement, because clearly, California, and in particular, some of the cleaner strategies that the state has championed for many years are of interest to many of our counterparts from around the world. And it's a unique opportunity because it also ties us into an opportunity to learn what is happening in other parts of the world and how people are tackling the issue of air pollution. Just to, again, make sure that we're all on the same page, when we talk about attainment, we often refer to something called the Sacramento Federal Non-Attainment Area. And you can see here the area outline. It's a multi-county area, but this is really the planning area for which we are trying to put in place air quality plans. So so it is broader than Sacramento County. And for that reason, we work very closely with 4 other air districts around us. So now let me get into just some of the basics about air pollution. And again, I'm not going to say anything that you don't already know, but I'm hoping that I'm bringing you some of the most recent, the latest late-breaking research that is pointing to some really interesting facts about air pollution. Some of the most recent work coming out of Susan Annenberg from George Washington University is looking at using satellite-based observations to look at how air pollution is distributed globally. And the takeaway here really is that depending on whose study you're looking at, whether it's the World Health Organization, whether it's some of these research groups in the US, for example, the article that I show on the slide is from the group from Harvard that recently estimated premature mortality due to exposure to particulate matter pollution. But so depending on whose number you look at, the impact is significant. We're talking about anywhere between 4 and 8 million premature deaths every year due to exposure to pollution levels, particle pollution levels that obviously don't meet the health standards. And what is interesting about these global maps is that you can see the disparity in terms of where these impacts are being felt the hardest. And no surprise, in the US and California, we are fortunate because our technology is cleaner, our fuels are cleaner. We've been at this for a little longer, but in many of the growing economies in the world, they're still dealing with dirtier vehicles and less clean equipment, and the fuels are not as clean as they could be. So that's one of the reasons why international engagement is important for all of us. More specifically, and especially for you folks that are perhaps more in tune with some of the clinical issues associated with exposure to pollution, some recent work from Annenberg's group has also associated the incidence of pediatric asthma and air pollution. And if I can just share some of our own work, recently we've been in collaboration with some folks here in the US and elsewhere, and we've been postulating the connection between exposure to ultrafine particles in particular. So these are the smallest of the particles in the PM profile, and neurological effects. So again, this is just some of the background. So that's really why we are concerned about air pollution and why we need to continue to drive towards meeting the ambient air quality attainment, ambient air quality standards to get to attainment. So in case you're not familiar with this, what are the standards? So this is what we call criteria pollution. So there's 6 basic pollutants that the federal government has adopted standards, and states and regions are mandated to have an air quality plan in place to meet the standards, to get to attainment. But really, the most important ones for most of us are going to be the ozone standards and the particulate matter standards. When it comes to ozone standards, the magic number is 70 ppb. When it comes to the particle, the PM particulate matter standards, we are mostly concerned with meeting the PM 2.5 standard that you see here, which is a daily standard of 35 micrograms per cubic meter. This is not to say that the other standards are not important, but in some cases, we've been able to more successfully make progress towards meeting those standards. It's these two that are the biggest headache that many urban areas around the nation and the world are dealing with. And we're at the juncture of a really interesting debate in the air quality community, because traditionally, the US standards were thought to be the most progressive, the most aggressive, the most up-to-date in terms of tying the health impacts and the pollution levels that can be accommodated in our ambient air. But very recently, just this last September, the WHO came out with the standards that are much more aggressive, much more stringent than even our own standards. And again, just to kind of give you the comparison of the numbers, they recently promulgated a 5 microgram per cubic meter PM 2.5 annual standard compared to 12 for us. They also promulgated a 15 microgram per cubic meter standard compared to 35 for us. And we can go down the list. I provided it to you for your reference. But what is interesting is we are at this point where the global values that the WHO is proposing are even more stringent than anything that we're contemplating in the US. At the moment, the US EPA is reviewing the PM standard, the PM 2.5 standard. We're expecting a decision in June, and if the agency decides to promulgate a more stringent standard, we're expecting that new rule to come out sometime next year. But that's a big question mark, right? Because it's hard to fathom that that the agency would go as stringent as the WHO. So stay tuned. It'll be interesting to see how this all plays out. And again, not to repeat or say something that you already know. Like many areas around the country and the state, we suffer from too much air pollution. The American Lung Association is doing a really good job releasing the State of the Air report every year. And the latest report that you can find on their website is putting our region, the Sacramento-Roseville region, number 6 worst ozone in the US, number 10 worst short-term particle pollution. So this is daily PM 2.5 concentrations. And number 24 worst in the nation for annual PM 2.5 concentration. So again, these are certainly not distinctions that we want to have, and everything we do is predicated on making sure that we get off this list as soon as possible. So where are the limits? So here's essentially just a quick graphic of what we're talking about. On your left, you have the trend in terms of PM 2.5 pollution in the region. On the right, you have the same graph for ozone. And as you can see, we're hovering around these lines that indicate the standards. We're not quite there yet, and that's where the work continues. When it comes to particle pollution, you know, the biggest source of this pollution is going to be wood burning. When it comes to ozone pollution, the biggest source of that pollution is going to be definitely transportation. Vehicles, engines, equipment, anything that burns fossil fuel. So that's where the focus is. And obviously, the fact that we're now dealing with the reality of wildfires around the year it doesn't make the work any easier. Here's a really interesting graphic that came out, and you can see anytime we get hit by a wildfire, we basically set air pollution levels. And you know, we go into frantic pace working with our friends at Sacramento Public Health and Dr. Kasseri to make sure that we get the information out to the public to protect themselves. But you know, when you see pollution levels in these, you know, highest levels, it's hard to do much of anything unless you really have a place where you can go and have some active filtration cleaning the air, because it's been terrible, as I'm sure you can appreciate. And luckily, we have some resources for monitoring. The federal government has been working with us and making available some really useful real-time portable sensors, crowdsourcing basically, where you can essentially click in different areas throughout the region and get a better sense in terms of what the pollution is near you, outside your window. This has been very, very useful, and we use it extensively. We point folks to this website when they're trying to get information in terms of, you know, what to do when we're impacted by a wildfire. So as I said, for an economy like California, where our you know, power grid is relatively clean because we've been dependent on natural gas for many years, the biggest source of pollution is really transportation. That's not to say that our cars are dirty and that we don't have the most aggressive standards in the world, but because there's so many of us, so many cars, you know, 26, 27 million on the road, and we drive so much, you know, that's the reason that when you add it all up, it becomes the biggest source of pollution and greenhouse gases. That's the most recent challenge. Now, so what do we do about this pollution? Well, not to oversimplify the solution, but I think it's pretty clear that we need to electrify everything as soon as possible. And we need to make sure that as we transition, that 100% of that electricity is renewable energy. When it comes to transportation, and when we think about how do we improve transportation, we need to really think about improving mobility, not just transportation. Luckily, we have a state with lots of money. Even before the windfall of recent years, the state had in place a cap and trade a program that was generating a lot of revenue, and that revenue is funneled through local regions where we can leverage these public investments to make sure that we modernize our vehicles, our fleets of equipment and other sources. But really, you know, not to get too political here, but I think the science is clear. We just got to cut the cord from fossil fuel combustion and, you know, try to get to complete electrification as quickly as possible. We've been doing this for a long time. The very first requirement for electric vehicles in California was adopted in 1990. So if you think of all the progress that gets reported in the media today, it's fantastic, and certainly it's quite an achievement, but it's taken us a long time. So one of the core programs, as I mentioned before, is making sure that our stationary sources are meeting every legal requirement in terms of the emission limits. And the only way to do that is if we're out and about. So we spend a lot of resources with our field inspectors and making sure that companies are reporting as they are required. And again, in terms of the transformation of transportation, we're fortunate that we're finally turning the inflection point where we see many more offerings in the marketplace in terms of light duty vehicles, heavy duty vehicles, and everything in between. And really the solution, as I oversimplify it here, is really electrons and molecules, meaning battery electric technologies as well as fuel cell electric technologies relying on hydrogen. I say no compromise because, again, if you think of something like a Tesla or some of the new vehicles on the market, they are superior products to combustion equivalents. They just happen to be zero emission electric. And then the reference here to the cheat-free alternative is obviously we had a role. We were involved in the Volkswagen Dieselgate cheating case, and you know, we don't want to see any of that anymore. I talked about cleaner investments, and you know, kind of to speed up the presentation so we can get to QA and discussion. The one thing I want to leave you with here is a lot of the programs that we're putting in place are targeting equity, meaning having low-income folks that traditionally would not be able to participate in the green economy have access to these programs. And some of the programs that we're most proud of are, you know, our Clean Cars for All program, for example, that is helping with subsidies for our folks that they can get into an EV, and also our community car sharing, where we're making mobility available to to various housing units in the region. And we're also at the cutting edge of this concept of mobility and kind of pushing the envelope to see what are the solutions that we're going to need for the long term. We broke ground on the very first mobility hub, e-mobility hub in the El Paso area. And what this is really, we've identified that in these mobility hubs, we can provide the transportation solutions that our most disadvantaged communities are lacking. And by concentrating, you can more efficiently align the resources that are needed. If you think of, having to bring the power, so we're working with SMUD on this, having to have access to the services from Sacramento RT, so we're working with them on this. So, stay tuned. We are making progress, and we invite all of you to come out and see the unveiling of what we hope to be the first of many mobility hubs coming in our region. A lot of what I talked about really is been understood by many of our jurisdictions. And just as an example, the mayors of Sacramento and West Sacramento partnered together and put together a climate change commission. And we went through a year-long process where we identify opportunities for decarbonize by focusing on the built environment, on mobility, and community health and resilience. So I'm only pointing this out to you because as you think of advising the county, this is the kind of thing that we want to see in a very progressive climate action plan, for example, that is really moving the needle to try to get to carbon zero as quickly as possible. And the last thing I'm going to mention, I'm trying to get to the end here, is there's a new state mandate, community air protection, AB 617, that is really focusing attention and resources to identify low-income disadvantaged communities. In our district, we've done the analysis and identified 10 different neighborhoods. The state has selected one of our 10 neighborhoods, Sacramento, Florida, as one of the initial communities for special emphasis. And the idea here is you take the cap and trade resources and make sure that you get emission reductions and benefits to these priority communities, and keep going until you get to all of them. Obviously, it's work in progress. We've been on the ground for 4 years, and the biggest challenge is that the state honestly just hasn't allocated the necessary resources for us to do what is expected. And the last point I'll make is this is really interesting because we're in the middle of developing a policy position on, obviously, shelter in place was great for clean air, right? Intuitively, everybody around the world saw that. But we've done the analysis in the Sacramento region, and we actually quantify the benefit of the fact that, for example, in April 2020, we saw a reduction of vehicle miles traveled by 70%. And that came with an improvement in pollution of anywhere between 10 to 35%, as you can see here. So we want to package this into a policy recommendation that says, as we envision getting back to normal, let's not forget that teleworking can be really good for our environment. Teleworking has been a cleaner strategy for many years. We just never really took it seriously. So hopefully we can find a balance where we can obviously support our economies opening up and our small businesses, but let's not go back to the way that used to be, where we're going to have to be dealing with excess pollution. So thank you. Please visit our website. We have a lot more information there, and I'll leave it at that and welcome your questions. Thank you.
Thank you so very much for that informative and in some ways uplifting and some ways depressing presentation. Where we are now is a long way from where we have to be, obviously, but the progress is good. It's great to see. I see a hand up already. Herman, would you have a question? You have to unmute yourself.
Oh, yeah, yes, hi.
Hi.
Let's see if you can hear me now. My name is Herman Barahona. I'm the lead organizer for the Sacramento Environmental Justice Coalition. We are a group of local churches and nonprofits and civic associations that are very concerned about the high concentration of pollution in low-income communities. And South Sacramento happens to be one of those places that has the largest concentration of permits that pollute the area. Of course, with the cumulative effects of traffic, the freeways, and mobile and non-mobile sources, we know that this localized issue will take many years to reverse, considering that it's been 5 decades of redlining in that neighborhood. But I'd like to hear from Dr. Ayala what the plan is to put some sort of policy that puts a moratorium on continuing to build more polluting sources in those neighborhoods.
Yeah, thank you for the question. I think the answer is clear. You know, it's all hands on deck. You know, I mean, it's going to be cleaner standards at the federal level, at the local level, so that we can get cleaner cars and zero emission as quickly as possible. You know, the fact that our very progressive utility SMART has adopted a zero carbon plan by 2030, the most aggressive in the nation, even more than the state, is going to help. As we see electrify solutions in the vehicle sector, those are going to spill over to some of the other sectors. Again, it's sort of, you know, we all need to look in the mirror, right? I mean, the reason we have pollution is because our economies are dependent on fossil fuels. So as soon as all of us can play a role, and as I said, cut the core, things are going to be getting better. So thank you for the question.
Is there any chance that the executive airport, the single engine airplanes will stop using leaded fuel?
Well, they can, because those engines are designed for specific fuels, right? But I mean, it's interesting. Again, I point to the EPA just last week is proposing new cleaner standards for those types of engines. So, you know, the federal administration, FAA, is very aware and concerned that these airports can have outsized impacts on local communities. And again, airports are federal jurisdiction. None of us can touch them. So again, it's a lot of the same formula, working together, advocating. Thankfully, we have a Biden administration that understands that these issues need to be tackled ASAP, and they also understand the importance of environmental justice and bringing equity to all the cleaner solutions that get rolled out by governments at the federal, state, and local level. So, you know, I agree with you. It's probably not going to happen as quickly as we would like it to see, but at the same time, you know, we're much better off now than we were under the previous administration, if I can say that.
Oh, and one more thing is the moratorium on giving permits. South Sac happens to have the highest concentration of permits that AQMD issues. Is there any way to prevent that from continuing, because it just keeps adding pollution to South Sacramento?
Well, again, you know, you're kind of preaching to the choir. Where a business is located is a local jurisdiction decision. So you and your organization and your partners here need to be advocating to the counties and to jurisdictions where they place those businesses. Our role is to make sure that those businesses comply with the legally binding and adopted emission requirements. And as long as a business does that and plays by the rules, you know, there's nothing else we can do. You know, we cannot go and shut people down, basically, right? I mean, that's just not the way things work. And that's why, as I said, a lot of the resources that we allocate is to make sure that, you know, people are complying with the rules that are legally binding. So thank you.
Thank you.
Thank you for the questions, Herman, and for the answers, Alberto. I see Joe Full has his hand up, and then Libby.
Hey, good afternoon, Dr. Ayala. Big fan of your work. Joe Fulbora here, formerly with Sacramento. I was just wondering, you know, our public health board team here, we also help advocate and support. Are there any near-term programs that your team might be advocating for in the local regional levels that we can hopefully send a support letter to, or help you out if there's any competitive funds or any competitive programs that you may need our support? I looked at the Biden infrastructure playbook, and they did hearken a lot on community engagement and public health officials to step up and weigh in on some of the financial decision making that's happening in the state, regional, and local levels. So I'm just kind of curious, are there any steps for us that we can probably help you or potentially help your team in getting to that next level?
Well, I very much appreciate the offer, Joe Phil, and it's great to see you here. And I'll definitely take you up on it. I mean, there are many. And in fact, one of the reasons that I thank Dr. Hoffman for inviting me was the fact that I hope that this is but the first conversation we have and we actually build a relationship, because there are many efforts at the state and at the federal level. As you may know from your work with Sacramento RT, we are developing a strong coordination to make sure that many of our agencies in the region are aligned to be competitive for some of the federal funding that is coming. And even at the state level, I mean, you're very aware of AB 617 and the underfunding issues that it's facing. I mentioned we've identified 10 neighborhoods that need attention just in our region. And the state has only allocated partial funding for one, South Sacramento, Florence. So I mean, that's one obvious area. And I would love to have the opportunity to engage and continue to work with you all. Because clearly your voice is very important. This is all about public health. At the end of the day, we want to make sure that we protect our breathers, and especially those that have been most disproportionately impacted. And I'm sure that there's a lot of intersections where we can help each other in that regard.
Thank you, sir. And we look forward to working with you ongoing. And I'll work with Dr. Kaufman to make sure that we are engaged and hopefully lend a voice of support should those opportunities arise. Thank you so much.
Thank you very much. Appreciate it.
Thanks, Joe Phil. Libby?
Great. Thanks so much, Alberto. A really interesting presentation. I actually had a question very similar to Joe Phil's, so am keen to learn a little bit more about some of the practical county level sort of actions that are on your radar. Maybe we can do a follow-up presentation, or there's some information you could share with us to think about how we can support you. Two specific questions. So the first is on kind of thinking about air pollution. You talked about air filtration centers. I'm wondering if you're aware of any local efforts to establish air filtration centers for bad air quality days, particularly for populations who don't have access to individual or home level filters. And then sort of second of that is just if you could shed some light on some of the health impacts around that. I read recently around impacts on preterm birth for women who are pregnant when they're exposed to air quality issues. So I'd love to hear a little bit more about that. And then the second is just to talk a little bit more about the electrification of transport and public transport and what's being done at the local level. I think you talked a lot about kind of state level initiatives, but what are we doing, or what could we be doing more of in Sac County and this air quality district? Thanks so much.
Okay, thank you. Wow, those are three great questions. So let me run through them real quickly. On advocating, I mean, if I can be just candid with you guys, we need your help because, as you can imagine, the demand for funding exceeds what the state has, even in spite of the current windfall. So one of the things that we're always working on is to be competitive as a region. No secret, you know, a lot of the money, a lot of the attention goes down to LA, Southern California, it goes down to the Valley, it goes down to the Bay Area. So there's a very healthy competition that all the regions go under on a yearly basis as the state budget is being programmed. And, you know, some years we do better than others. And, you know, we always welcome a voice like yours to help us be honestly more competitive. We want to have access to those state funds so that we can leverage some local funding and then achieve more in terms of this transition and modernization of all our vehicles and equipment. So that's the first. The second, on the cleaner centers, you know, this is something that I'm sure Dr. Kasseri can speak to you guys about in the future, and I'd be more than happy to come back. But I mean, that is the crux of it. We're trying to figure out if having cleaner centers, whether it's a jurisdiction, whether it's funded by the state funds or elsewhere, if that is part of the solution. And it does need to be a sort of an organized approach where, you know, it's not only just opening up a cleaner center, but, you know, can people actually get to it, right? Or are we going to need to transport people? One of the suggestions that we've been telling people is sometimes we've been under such awful pollution impacts that even in your home, you can smell the smoke from outside. So now you're talking about setting up one of your rooms, one room in your home, and have an active air purifier. Many organizations like Breathe California have been doing these workshops where they show people how to MacGyver an air filter on their own with a cheap fan and other devices. So I think it's going to take a lot of those solutions to put in place. And unfortunately, as we get hit by wildfires, this year we'll be better off than last year, and next year we'll be better off because we've taken this year's lessons. So I think it's going to be a part of the solution. We are working under by legislative mandate to put together a better organization plan for the region to deal with wildfires. So in the next remaining of the year, you're going to hear more about this work that we are in coordination with public health at the county and many others. But the point is well taken. I mean, we are at the point where this is climate adaptation. This is really how we are going to equip ourselves to be able to deal with this warming future that it's already here. And then the last thing, you mentioned electrification. I mean, it is happening on the road. I mean, every EV that you see around is an EV that is likely funded by state or local dollars. We have been working with, for example, Sacramento RT to fund the electric vehicle shuttles that they've been deploying. We're doing a lot of funding of charging infrastructure. I mean, we are the leading air agency in California where 98% of our state dollars are dedicated to electrification. 98% of every dollar that we get from the state, we're dedicating to either funding electric school buses, for example, or putting chargers on the ground. And we want to continue that. So a lot of it is happening because of these local programs that are leveraging access to state funds. And now what we want to do is continue that and also hopefully bring some of the federal funding our way.
Thank you, appreciate it.
Thanks so much. Alberto, I have a tough question here politically.
Okay.
The county's climate action plan has been criticized for not stressing infill more than continued development. And we need housing, but as we spread out with the sprawl, that impacts how much pollution is contributed to the climate through transportation. Most people will still drive. So have there been any calculations as to the impacts? I know the environmental impact reports need to be done for certain developments, but are you doing any calculations about how much that would add to our current pollution burden for these various developments?
Well, I think the answer to that is yes, and it's going to be more general than just what we do, because I'm going to channel our friends at SACOG, who, as you know, similar to the mandates that we implement, they have their own infield development SB 375 mandate. And it's clear that, in many of these areas, we work shoulder to shoulder, and no secret that, if you're going to force people to depend on the car, most cars are still combustion. So you're going to have an impact on air pollution. So I think that is clear. So we are very supportive of doing anything to promote infield development, to promote transit-oriented development, to promote alternatives to single vehicle driving, especially if that vehicle is going to be combustion. So, and thankfully, I think we know that we have some solutions, right? I mean, before the pandemic, we had one of the most successful electric bike sharing programs in the world. We were second in the world when the jump bikes were at the peak of utilization. We were only behind Paris, who had been going, yeah, exactly, right? So right now we're trying to get back to the discussion table to organize ourselves to see how can we recover some of what we lost and kind of get to those services in terms of mobility. But to your point, I don't think we need to sugarcoat it. I mean, if we continue to develop and we continue to plan for the vehicle instead of for the pedestrian, we are likely going to have to deal with transportation combustion emissions, because unfortunately, the transition to 100% of every vehicle, 100% of every engine being zero emissions, meaning electric, fuel cells or batteries, it's going to take decades.
Yeah.
And, every year of combustion is every year that we're going to have to deal with adverse health effects from pollution, as I indicated.
So, well, I'll just leave it at what can we do to help influence this? I was looking for numbers, and do they come to you, or do you weigh in on these action plans and say this is going to cause X, Y, Z, or is?
Sorry, yeah, you're right. Your question was specific. So SACOG, as part of the Sustainable Community Strategies that has to be adopted and approved, and the Metropolitan Transportation Plan, they do those sorts of calculations in terms of projections, in terms of where the development is going to go, because every jurisdiction has to submit that. Then they determine what sort of induced traffic that is going to create. We work with SACOG because, as I mentioned, we need to make sure that we have an air quality plan in the region that still puts us in attainment. So the information is there. In addition to that, just to give you an example, a couple of years ago, we put together an analysis for Senator Dr. Richard Pan, who was very interested specifically in the carbon footprint of the state workers. Sacramento being a government town, before the pandemic, we were having 50,000 state workers driving in and out every day. And you can imagine, I mean, that's a huge carbon footprint. So we were working with Dr. Pan, basically saying, here's the impact, what can we do about it? So I think the numbers are out there, and I'd be happy to work with you and make those available. But what can you do? I think you know what the answer to that is do whatever you can in your power to make sure that the solutions are there. I think we just need to make sure that we identify a way to get there in a way that we can afford it, so we don't shut down our economy, and also honestly just have the political will.
Yeah, absolutely. Thank you. And we're running out of time, but I did want to just add this other question from the chat. Herman had a question about adding air monitors, the federal regulatory air monitors, to South Sac, where there are none.
The one thing that we are rich in the Sacramento region, and we are the richest of many, is in air monitoring. We will be releasing a public document that I'd be happy to share with you all, where we've actually identified 6 distinct air monitoring efforts. One of them being the federal regulatory network that we run. We have about a dozen stations that are part of a 4,000 station network across the US. But there are distinct efforts, including Sacramento County, Dr. Kasiri, who recently got a grant from the AG's office to do some monitoring. So we're not lacking monitoring. Now we just have to make sure that we all end up with data that can be actionable. And like I said, I'd be happy to provide that information to you guys. Okay, I think he was specifically asking about in that neighborhood, in that district, but because I think he knows this, because of AB 617 in South Sacramento, the very first thing we did is deploy monitoring. So, not only is our region rich in monitoring, but even South Sacramento it's got the most monitoring. So we just need to work together to use the data in a way that protects communities. Okay. Herman, we're really out of time. So is this quick hand up, quick question?
Oh, just a clarification. The low-cost monitors that are going to be deployed in town are, there's a lot of money being put into low-cost monitors. Federal monitors trigger enforcement, and there are none in South Sac. So what would it take to take 1 or 2 federal regulatory enforcement monitors into South Sacramento?
Well, it's not quite correct that you cannot take enforcement based. I mean, data is data, and the fact that something is low cost, as you call it, doesn't make it bad or insufficient. The federal monitors are federal, so it's basically EPA funding them, and they're very expensive, as you can imagine. So, if EPA wants to give the Sacramento region the funding to do more monitors, then, we're willing to work with them. But I mean, that typically the trend is not to have more monitors, because again, we don't need regulatory monitors to meet the objective of the Clean Air Act. We have a good understanding of regional air pollution.
Yeah.
I think your question is, can we have other data to make it actionable? And the answer is yes, and it doesn't need to be a federal regulatory monitor.
That's good to know. Thank you. Okay, so much information and so many possibilities of areas to work with you on this. So we will pursue that. Thank you so much.
I very much welcome the chance to work with you, and thank you again for the invitation. And I wish you a good meeting. Thank you again.
Thank you. Okay, we're moving on. I understood that we have a shorter working committee update, so that's good because we have less time. So I'll turn it right over to Libby and get some update on what the committee's been doing.
Sure, yeah, happy to keep it short. I think as I updated last month, we've split into 3 kind of work streams for this year where we really want to double down on some of what we feel is the unfinished work of the working committee. The first is working on data transparency, and I'll actually ask Phil to give his 30-second update because he's leading that work stream. The second is on alternatives to incarceration, and if Liz doesn't mind giving her update, I'd love to have her do that quickly. And then the third is Steve leading kind of connections, where again, he can give his own update. I'm happy to do it. I just think we've sort of empowered people to lead the substreams. So if that's fine, I'll pass to Phil, and then we can go to Liz, and then we can go to Steve just for kind of a quick summary update in the last month. Phil, do you want to jump in?
Hey, yeah, thanks, Libby. I'm actually in the emergency department right now, so I don't have a ton of time to chat, but I'm listening in. And I don't have any specific updates on the data collection stuff. Working on still laying the groundwork and drafting some of the data elements that we are hoping to be able to produce and kind of figure out how to obtain those in a regular manner and make sure that they're available to the appropriate stakeholders. But yeah, no deliverables at this point, but I will keep you all posted.
Thank you.
Thanks, Phil. Liz?
Sure. Was not prepared for this, but happy to just give a quick update. Yeah, we, so as part of the jail health subcommittee, correctional health subcommittee, we are working on a letter of recommendations for priorities of what the board can invest in ahead of their budget decisions this year, to have an impact on decreasing the jail population. Of course, recognizing that, and we're, recognizing that care will be, it will be easier to improve care with a lower jail population. So yeah, we are working on that letter, and we'll keep you updated.
Thank you.
And then Steve, maybe you just want to update on some of the conversations and connections you've made in the last few weeks, including with Judge Brown and the courts.
Yeah, I think Steve might have had to drop off.
Okay, well, just to say quickly that Steve's job is kind of making sure that we're thinking about connecting with all the right people here. So among other connections he's made, we connected with the Forensic Behavioral Health Division and Jeff Twitchell in the last few weeks to kind of try to learn about what the plans are there and how that impacts the space that we're investigating. The second piece is he connected us to Judge Brown, who leads several of the specialized courts, including mental health court. So that's really helpful for helping us understand sort of as a justice-involved individual moves through the courts, what are their options? How do the judges view the set of options? And how does that relate to some of what we're putting together on pretrial options and diversion? So lots going on, and a huge thanks to everybody. It feels like we've kind of revived some energy in this work and a lot of time going into it, but excited for some of the things that will come out in the next few months. Our aim, Farla, right, is to present the ATI letter in a month on the March meeting.
Yeah, hopefully, yes.
Great. Okay.
Okay, Thank you so much. That's terrific. I'm going to cede the other current activities item so that we can get back to the questions for Dr. Damiano, and thank you for waiting. So I believe that Libby and Aparna had their hands up for questions. And thank you, Dr. Damiano, for being here to answer these. I know it's a little awkward, but I appreciate your cooperation. So Libby, would you like to ask a question first?
Yeah, sure. I know we're short on time, so if this is something we park for next month's meeting, that's okay, but I would love a little bit more of a walkthrough on that last table that was on the screen. I'm not sure I was clear on what the sort of takeaways were and how to interpret the open versus discharge columns.
So Libby, if it helps, I don't know if we'll have enough time to walk through the whole data piece. I do have the website posted on the Sheriff's Department, and we have several months, I think a year's worth of data posted. If there is one of the small working groups that wants me to come to your meeting and kind of walk through it, I can. But basically, just in a nutshell, when we provide the data to behavioral health, they work it through their entire system, and that's how they determine which of these inmates are open to their services or have touched their services but are no longer open to their services. So as you can see from the data, this isn't a pretty picture because you'd like to have more people open to services so that we can readily connect them. We do connect people back to their treatment provider for continuity of care. Our mental health staff in the jail are also connecting people who may need a connection where one is not available immediately to the APS clinic for medication and further linkages.
Okay, and just so I'm clear, when we say open to care, that means they're an active
patient with one of those mental health programs. Yes.
Okay, that's super helpful to understand. If we have further questions, would love to just take you up on that. Maybe we'll just email you some clarifiers so as not to take up the time here.
Yeah.
But also just wanted to say thank you. This was a super thorough report, and I appreciated all of it, including the sort of update on the consultant report. So thanks for sharing that.
You're welcome.
Thank you. Aparna and then Mac Wilson. So first, and then Phil, I guess.
Are you able to hear me?
Yeah, you're kind of quiet, but yes, we can hear you.
Okay, great. So Dr. Damiano, I have a couple of questions. My first is about the vaccination data for the incarcerated population. So it looks like the report only contains the cumulative number of vaccine doses that have been administered. And I have raised this question and this concern in the past. It is important that we see the current number of people in custody that are vaccinated or the point in time data, because otherwise there's no sense of how many people in custody are immunized. And this cumulative number isn't giving much valuable information. So I would appreciate if you could go back to including that data point in the report.
Okay, so you're kind of fade out, but one of the things I've done is every couple of months is we do a data poll on the current census of the jails and how many people are vaccinated. I have done that poll, I think 2 or 3 times and presented it to PHAB. The data have been fairly consistent for those times. It's about 30% of the jail population being vaccinated. And the reason for that is the high churn rate within the jail facilities. But we will do another data poll. I can't promise it will be this month because we're just tremendously taxed, but I will do another one. I do it periodically.
Okay, I would appreciate if we could get that data every month, because I think it's imperative.
Yeah, it's just not realistic for us because we have so many other data reports that we have to run, and it's a manual report.
Okay, and then when you do get that data, if you could add that to the website, I think that would be helpful. Now,
yeah, we don't typically, because I just got permission to add this cumulative data. So where I will present it will be in this meeting.
Okay, all right.
Yeah.
Is it
Uh-huh.
possible to get access to these documents that you share in the meeting?
Yeah, so
sorry, they're posted on our website, but I can arrange to have them sent when we receive them or during the meeting. People can ask us for us to send them to you. So just send in your email address and we'll put you on a mailing list where we can circulate these.
Okay, that sounds good. And my last question is regarding the contact tracing that you talked about. So are you concerned at all about the impact of positive cases among custody staff on the outbreaks?
I'm sorry, I can't really hear you very well, and I couldn't hear your whole comment or your whole question.
Okay, let me try again. I apologize.
Okay.
My next question is about contact tracing. So I was wondering if you're concerned at all about the positive cases among staff members, specifically custody staff members, on triggering these outbreaks.
Yeah, so I obviously I am concerned about staffing. The sheriff's office did put out noticing to all of their employees about the importance of wearing the N95s and the other surgical masks. All of the sheriff's department that works in the health areas are required to be fully vaccinated. But obviously for the infectious level of this disease, we've had, concerns because it's been overwhelming, but we do meet with them regularly and have contact pretty much every day with the sheriff's department.
Okay, and do you know how many sheriff's employees working at the jail are vaccinated?
No, so I think we've had this conversation before, and I did give a contact person for the sheriff's department to our chair, to the PHAB chair.
Yeah. And so we have our working committee will be contacting the sheriff's contact person to try and get that information. So I'd like to move on. So Matt can get to ask his question before the end of the meeting. Thank you.
Yeah, thanks so much. Can you hear me well?
Yes.
Good. First, I want to double down on the point in time data, like things like currently in custody, tested positive, negative, testing, vaccination numbers of staff. I understand that the turnaround is high, but considering that there is restricting, I'm wondering if that means that like could possibly be high, like higher, or give more restrictions. If there's less turnaround inside the jail, so we can.
I'm sorry, you're cutting in and out.
Can you hear me now?
I can. It's just a lot of your stuff got cut off for me for some reason. It might be my computer.
Okay, no worries. I'll start again. I just want to double down on the point in time data. Currently in custody, tested positive, negative, testing numbers, staff, the vax numbers. I recognize that it's high, but I'm interested in hearing about that maybe later, because I hear that there are restrictions, which means the restrictions should be higher, because there shouldn't be high turnaround, and if people are getting in and out like that, maybe we shouldn't even have them in there in the first place. But I have 3 questions that all kind of lead into the same kind of thing, so I don't believe they'll take up time. I saw your staff. You mean that your team is severely short-staffed? I saw that 60% of the jail is dealing with mental health crisis. 30% is going through severe mental health crisis. I saw the main jail number almost double, and our CCC number almost triple since the last COVID update. My question around that is if you plan doing more release into. I saw that the population is 3,300 and was interested in why only 200 plus people were released. The example of 65 or older and folks with medical conditions, we know that there's more than 43 people in there, but I'm really interested to see why only 7 was released. That's alarming. And so my question is what is the process? Who's making these decisions? What's your power in these decision makings? And then I'm with an organization that is closely working with folks inside the jails, and they've been reporting that they're being positive people in cells and in dorms, the lack of ability to isolate, and even speaking to like isolation means more mental health crisis. So, you know, they also say that they're not being given soap or masks. And then guards are not wearing their masks. So I don't know about everybody else in this room, but like I'm very prone to believe them. You know, they're on the ground every day, experiencing this every day. And I know it's hard to, you know, provide oversight when you're not on the ground all day, especially over sheriffs who aren't even in your department. And so I am hoping that maybe you could speak to that a little bit though.
Okay, that was a lot of questions. So on the average daily population, there's really two populations. There's a very short turnaround population, and then there's a longer term population. You have to recall that about 50%, 55% are released within 3 days. So there's a very crisp turnaround point for the jail. And I have presented that information at this meeting before, and I can give it again to maybe to the work group. For the sheriff's officers, those were very specific releases to help with some of the compression. This is under the sheriff's department on these specialized releases, and Farla can ask more questions from the sheriff's contact, but it was really only around the county sentenced people, not on pre-sentence, not on federal inmates, and not on those people that are waiting transfer to prison or state hospital. For the branch jail, every time I get a concern, I do send it to the sheriff's department. There is a mask program over there in terms of replenishing the masks. They will give hygiene. Whenever my staff see people without masks, they are reminding them to wear their masks, and also, you know, as infection control and health, we will do that. So again, if you have specific questions for the sheriff's department, I would give those to our chair, and then they will meet with the sheriff's corrections staff person.
Okay.
Okay.
Most of the decisions are counted on their protocols and about possible upcoming releases. That's what you're saying? Follow up with.
I'm sorry, I really only can hear part of your conversation. Yeah. So you might want to write your question to our chair, and she can ask it during their meeting with the corrections point. But these were very specific releases. We do release other people. The sheriff's department releases other people on a daily basis that are released by the court system.
Yeah, please enter your question in the chat, and I can take it down. Also, Liz, if it's okay, would you like to enter, is it possible to enter an email address where people can email questions after the meeting?
You're speaking to Liz Gomez, correct?
Yes, sorry, Liz.
Oh, so sorry.
Sorry,
I assumed you were talking about the subcommittee.
No.
So
that would be an option too.
Okay, just questions that you want to follow up on, or
yeah, that we could follow up on probably with the working committee.
Got it. Yeah, so I will put my email in the chat, and Farla and I can connect, make sure that gets to the subcommittee. I did note down all of Mac's questions in the notes, so we can provide that. I was able to kind of pull together, even though it was a little difficult to hear.
Yeah, it was. So it's good that they entered something into the chat, and now we have Liz Gomez's address at the county. If anybody on the meeting would like to send questions that can be forwarded, that would be great. I do have Mac's question in the chat, and I see Aparna's suggestion. So at that, we will take these under consideration, and please reach out if you have more questions. Okay, so there are comments, and we will make sure that those get considered. All right, thank you very much. We're over time. I appreciate your indulgence in that, and look forward to seeing you all next meeting. Thank you so much to Dr. Damiano again. We'll try and change the way we have these questions put forth. We'll think about a different procedure as well, or an additional procedure that will facilitate more of this within one contained meeting. All right, thank you again. See you next time in March.